Good afternoon, dear listeners and viewers of Equinoxe Radio and Television. You're welcome to your health program, You and Health Ed on Equinoxe Radio. Multimedia, it is a platform for us to discuss on health-related issues. And for presentation, I am Monsieur Lucy Liengu. You might have experienced or you are experiencing repeated episodes of sudden feeling of intense anxiety, fear, or maybe terror that reach a certain peak within minutes that cause you to panic. As a result, those around you think you are mentally deranged or maybe you're performing some sort of witchcraft in order to avoid some weird reactions from those around you or your neighborhood. You have decided to isolate yourself. Today we'll be discussing on this, especially on what concerns anxiety disorders. You might have been experiencing this in your daily life. And before I introduce our guest for the day, I have the honor to introduce my co-host, Immaculate Forgwe. Good afternoon.
Good afternoon to you, Lucy. Good afternoon to you, Doctor. And good afternoon to our millions of listeners and also televiewers. It's always a pleasure being here.
And our special guest for the day is no other person than Dr. TOGUEM Guy. He is a psychiatrist. Good afternoon, Doctor.
Good afternoon, Lucy.
It is a pleasure having you on our program today.
Pleasure is mine too.
All right, straight away we'll begin with the first question. Doctor would like to understand, when we are talking about anxiety disorders, how can a layman define this?
Well, basically, anxiety disorder is just fear. Okay, either too much fear or fear all of the time, because it's normal to feel some fear, but it shouldn't be there all the time. It shouldn't be too much. It shouldn't disturb your normal living. Okay, so the layman, that's how you can identify it. But also, usually, they might take it as spiritual attack, so there are many interpretations.
How does this differ from other anxieties, other forms of anxieties?
No, from the time you call it disorder, it means that it has reached the intensity of an illness. Okay, so the difference between the normal fear and the fear which is an illness is the fact that the illness might either be there all the time. It's not normal, so you don't always have a reason to be afraid, but it can happen sometimes. But when it's there all the time, then it might be an illness. Or when it is too intense, some people might even feel like if they are about to die, like if there is a spirit threatening them, preventing them from sleeping, they are unable to be on ease. There's always a feeling of unease, stuff like that. So when the intensity is too much, when you feel like you are unable to bear it on yourself, then it's becoming an illness.
Doctor, apart from fear, how does anxiety affect daily life? What are some other symptoms different from the fear?
Well, from other symptoms, most of the time you have palpitations. They will go and see the cardiologist because the heart's beating too fast and stuff like that. They do the exams. All of them are normal. They might have headache. They do scan. They do MRI. Everything is normal. They might even have a pain in the back. They might have cramps. They take calcium all the time. The cramps are still persisting. And we feel like some might have, like, they have some sentiment that something bad is about to happen. Okay, and they carry that with them. It becomes heavy, and there's a feeling of unease. Sometimes the blood pressure might even increase. They might not be able to sleep because they're having fears, thoughts, like uncomfortable thoughts that are coming in the mind and preventing them from sleeping. Okay, so those are basically the main symptoms. Then now you can get to an extent where you're unable to work because you're unable to focus, to concentrate, because those thoughts are always disturbing you. Or you're unable even to be, like, how can I put it? Sometimes to an extent where people go to the emergency department because they feel like, I'm about to die. Okay, they do all the tests, but everything is normal. So
looking at genetics and environment, how can they contribute to such triggers?
No, for sure, most of the time when you have anxiety disorder, all of us, we have built with some genes which play a role in the way we apprehend life, in the way we deal with daily life. Okay, so some people may have more genes that make them more vulnerable to anxiety disorder than others. But at the end of the day, it is usually a consequence of a triggering factor in the environment. It can be any kind of stress, either at work, at school, in your personal life, or like anything that makes you feel uncomfortable can be a trigger. And the more intense it is, the more likely it is to lead to a anxiety disorder.
You are a specialist in this domain. Tell us, on a daily basis, how many patients can you receive at your clinic?
I would say maybe 1/3 of my patients are suffering from anxiety, but my clinic is not really representative, okay, of the population of Douala, because generally in Douala you might say 15% of the population has the anxiety disorder. That is more than 1 person in 10.
And what are some of the dominant causes of this?
It's usually the daily life of stress, maybe struggling with finance, struggling for any kind of struggle. For example, right now in Cameroon, it is sure that money is life is becoming more and more hard. Okay, you have the insecurity in the English-speaking areas, which also makes life not easy. Okay, and even more recently, you have some issues with climate change that might make food more expensive or more difficult to get. So all those issues, since COVID, life has become more expensive. So all those things, or even a fight in your couple, whichever thing that makes you less comfortable can be a trigger for an anxiety disorder. Even if you have an illness, you can have a malaria, and then because the malaria, you are so afraid that then it triggers another anxiety disorder. So whatever kind of stress, whichever thing that makes you feel uncomfortable, can be a trigger for the stress.
Okay. And also, what are the most common treatment options available when we are suffering from this condition? Is it preferable to go traditionally, or is it preferable to come to the hospital to seek medical attention?
What I would say is that I'm not an expert for tradition. I'm not an expert for religion, so I cannot speak about that one, okay? But as a medical doctor, I know that at least the good thing about medicine is that the things we do are things that has been shown to work, okay? You see that it's not always 100%. Even though people might think that it is secondary to witchcraft or whatever it is, we still deal with those things. We are still able to cure those things, okay? Wherever they come from. And even if people go on my social media platform, they will see many cases of people who have been to traditional healers and then they came back to me with anxiety disorder and they have been treated. So now, how do we deal with those things in the hospital or from the medical perspective? Usually there are two tools, okay? The first tool is the speech, okay? And the second tool is medication. Yes. So depending now on the intensity, on the form, we might decide to, we might choose the best combination between those two tools, okay? Either psychotherapy or drugs or both, and there are different ways to adjust those things. But at the end of the day, the aim is for you to get rid of that condition. And by the way, many of them even go to hospital with gastric ulcer. In many cases, it presents with gastric ulcer. So,
from your explanation, it's very clear that therapy plays a significant role in helping those who are suffering with such a condition. How about family members and loved ones living around these people that are suffering with this disorder? How can they help them throughout this moment?
I think usually there is a general principle in life, okay? When someone has an issue, if you identify that someone is suffering from anything, you approach the person, you ask him what's going on, and you see how you can assist, okay? And if you realize that you are, with whatever you have done, it's not working, okay? Maybe it's time to reach out to a professional, okay? So if in this case, as we are talking about anxiety disorder, from the time the patient is having a symptom at home, nobody knows really what is the diagnosis, okay? But the person might, as we said, might feel this fear, this unease, might have insomnia, palpitation, or gastric pain coming all the time and stuff like that, headache. So if you have such a person, you have tried what you can do and it's not working, then go to the hospital, okay? And by the way, as far as you know that it's an illness, you know that it's not the fault of the person. So you might treat them differently, because many times you might hear things like, why are you so afraid? Just breathe, there's no problem. Why are you stressing yourself? But if you know it's an illness, then you might hold on a bit on those kind of words anyway.
Now, what last word do you have for people who are watching you right now and they are facing the same problem we are talking about?
No, what I would say is that they should reach out to a mental health professional, okay? Ideally a psychiatrist if they can have one in their area, okay? Yes, because there are solutions for those conditions are treatable.
All right, thank you very much, Dr. TOGUEM Guy. Hope to have you again next time.
Okay, Lucy, you're welcome.
Always a pleasure, right? Okay. Thank you very much, Immaculate Fogbe.
It's a pleasure being here, Lucy.
Thank you, ladies and gentlemen, for your time and for listening. For presentation, I have been a Lucy Liengu, and we received Dr. TOGUEM Guy. He is a psychiatrist. Do stay in the company of interesting programs on Equinoxe television and radio.